So funded by the NIHR, the ALOIS Community project was a pioneering attempt to build a sustainable online consumer community in dementia research, so quite ambitious. It was the brainchild of Rupert McShane, who's the co-ed of the dementia group, who had the idea of seeing if it was feasible to recruit and train carers of people with dementia to help maintain the dementia group's specialised register, which is called ALOIS, after Alois Alzheimer. So the plan was to create a community of research-savvy carers who would advocate for evidence in their dealings with the NHS, with NHS professionals at all levels, raise awareness of Cochrane, and feel empowered to get involved in primary research as well as systematic reviews. So you can see here we set up a website which was designed to act as a welcoming online gateway to the friendly dementia group team, and give the opportunity to get involved with our work without ever meeting us or leaving home. So for many reasons, we thought that this might be an attractive way for carers to contribute to research, which would fit around their caring responsibilities and other commitments. Okay, so what did we want them to do? In short, what we were asking people to do was basically populate a characteristics of included studies table, but outside the review process. We asked people to read a report of a randomized trial like this one about vitamin B and extract about 20 pieces of information about the trial, such as the number of participants, the patient population, the intervention, dosage, outcomes, everything that's important information which would go into a Cochrane review. Volunteers would then enter this information directly into the ALOIS online database. Whilst they were getting to grips with this task, they were given a coding manual and, crucially, personal support from the dementia group's information specialist, Anna Knowles Storr. So this was one-to-one support we were offering people, which was quite something. And the result of their hard work would be a searchable study record, which looks like this. Stunned silence. So, as you can imagine, recruiting carers to do this task was somewhat challenging. There is nothing more terrifying than standing up in front of around 100 hungry carers and carees at a dementia lunch club and trying to explain Cochrane, sell this unique volunteering opportunity at the same time. Anna and I went on a small tour of carer groups around Oxfordshire, and with invaluable help of Sally Crowe and Amanda Bowles, we also ran a very successful research skills workshop in Oxford. You can see the poster for that there. So this in particular really seemed to get people interested in the project, but did not translate into a huge number of carers signing up for the challenge. To tell the truth, Anna couldn't possibly have supported too many people who were not already familiar with research to do the task, so it was just as well that not too many carers did sign up. We did, however, attract lots of other volunteers, such as school and medical students, early career researchers, psychologists, and just people who wanted to get involved in dementia research, Cochrane, or both. Not surprisingly, it was more attractive to people with an academic interest in research rather than consumers. However, an important part of the project was to produce training materials to entice people and orientate them into the wonderful world of research and Cochrane and systematic reviews, in the hope they would feel inspired to volunteer. So I produced a small set of interactive training modules which used real dementia research examples to illustrate the general principles of evidence-based medicine, the importance of systematic reviews, and why you should be skeptical about Daily Mail headlines. Although they use dementia examples, because of the primary intended audience of carers, they do cover all the research and Cochrane basics, and they assume little or no previous knowledge of health research at all. All they assume is a basic interest. So they're particularly useful for patients and carers and members of the public who have been personally affected by a health condition and perhaps want to help, but they don't know much about it beyond Googling and what they hear from the media. So these modules have now found a new home on the Cochrane training website, and are currently the main Cochrane for Consumers pathway. So, for example, if a member of the public gets in touch with you and perhaps you haven't got anything for them to do straight away, you could point them to these modules as an induction into what Cochrane is all about to help them decide if they want to get more involved. So in 2012, the ALOIS project ran out of funding, but I'm pleased to say the principle of creating an online Cochrane contributor community lived on, firstly in the M-based screening project, which some of you may know about, which has now morphed into a brand new citizen science platform called Cochrane Crowd, which is part of Project Transform. So the ALOIS project proved it was not really feasible to train large numbers of research newcomers to read and code study reports. However, the M-based screening project proves it was feasible to recruit and train very large numbers of people to screen titles and abstracts to identify records of randomized trials, having recruited over 2,000 volunteers from 31 countries who have made nearly 726,000 classifications, which is quite extraordinary. It's fair to say that, unlike the ALOIS project, the target audience for this task is not consumers, as the task of screening citations, whilst very important to Cochrane, is not particularly consumer friendly. However, what's really great about it is that there's an online training module for the task, which allows people who want to help. It allows them to dive in and contribute extremely quickly, without too much onerous training. So to illustrate that, so newcomers first get an explanation of what the task is about. Then they can sign up for an account. If they're interested, they sign up for an account. They'll be given a dashboard which will keep record of their activities and their achievements. They can go through a set of training records and receive feedback on classification decisions they make about citations. And then they can just dive in and get right on and start identifying randomized trials. It can be really quick and easy, and as you can imagine, some people really take to it. From the consumer involvement side of things, what's exciting to me is that soon Cochrane Crowd will offer volunteers a chance to do descriptive coding tasks, similar to the ones I described on the ALOIS project. And the platform will also allow people to choose the condition or healthcare area that they wish to work on, such as dementia or stroke or complementary medicine, or whatever they're interested in, which will nicely link with work on reviews and with review groups. Last but not least, I want to talk about Task Exchange, which is another new Cochrane online community, which is more of a general marketplace for Cochrane tasks. It's a user-friendly, accessible platform for Cochrane review groups to offer traditional consumer tasks, such as commenting on protocols, reviews, and plain language summaries. You can browse by area of interest or by the skill needed or offered, things like translation or providing any sort of consumer input at all. Consumer contributors can set up a personal profile like this, listing their interests and skills. So it's a little bit like an online dating agency, and this will allow Cochrane authors and staff to approach consumers directly with opportunities that will be of interest to them. For example, you can see here the Wounds Group is currently looking to widen their panel of consumer referees, so they're inviting consumers to get in touch with them. So there's a way for Cochrane groups to reach out to consumers. It's early days, but I think it's an exciting initiative. So that's it from me, and I'd be very happy to hear any comments and answer questions if I possibly can. Thank you.